Hello, I am Jason MD, Professional Irrational, with my topic Treatment of Diseases Caused by Protozoan. I'll be showing my table of content, first being malaria, amoebiasis, toxoplasmosis, and later on I'll be sharing you some ways on how to not get these diseases because the prevention is always better than treatment. Well, let's start with malaria. Malaria can only be transmitted through infected Anopheles mosquitoes, a type of mosquito only found in warmer countries. Now, what are the other causes? We know that malaria is transmitted through mosquitoes. However, did you know there are also other types? Second, an infected mother can pass the disease to her baby at birth. This is called congenital malaria. Third, malaria is transmitted by blood, so it can be gotten through an organ transplant, transfusion, or using a used needle. What are the symptoms? Well, the general symptoms are moderate to severe shaking chills, high fever, and sweating. However, some symptoms don't always happen, such as headache, vomiting, and diarrhea. Malaria symptoms can show within 6 to 30 days after the mosquito bite. But in some cases, malaria can lie dormant in your body and symptoms will start to show after a year. Diagnosis? The only way to see for sure if a patient has malaria is through a blood test. The treatment also varies depending on what type of malaria is seen under the microscope. Blood tests can take days and some under 15 minutes. This way, it can also show if malaria has drug-resistant properties or is affecting any vital organs such as the lungs, liver, and kidneys. And as for treatment, treatment will vary on the person's age, the type of malaria, the severity of the symptoms, and whether they are pregnant. Some common anti-malaria drugs. Okay, but first, let's start with uncomplicated. Uncomplicated is divided into two, not drug resistant and drug resistant. For non-drug resistance, people with malaria only need to take chloroquine. For drug resistant, they require artemisinin-based combination therapies or ACT, which ACTs are pretty much just a combination of different anti-malarial tablets such as lumefantrine, mefloquine, amodiaquine, sulfadoxine, pyrimethamine, and others. But in a summary, it's just a combination of other anti-malarial drugs. For pregnant women, both pregnant women and for kids can take primaquine. However, do you know pregnant women take primaquine? Small amounts of that primaquine enter the breast milk of lactating women. However, the babies drinking this breast milk will not cure them of malaria. Pediatric patients have to go through therapy and get their recommended dosage of primaquine. Now, severe cases of malaria. For patients with severe malaria, they should be treated with intravenous 4, which is in directly injecting antimalarial drugs into the patient's veins. With all that was said, we are now sure that you do not have malaria. But what about amoebiasis? Amoebiasis is mainly gotten from the protozoan Entamoeba histolytica. Mainly targets the small intestines, where it can grow into trophozoite. The causes of infections are from the ingestion of amoebic cysts, which is its infective stage. People can get this infection by ingesting contaminated water or food. People with amoebiasis excrete the mature version of the protozoan in their feces. As for signs and symptoms, you can have nausea, diarrhea, weight loss, or stomach cramping, and occasional fever. In rare cases, the protozoa invades the liver and creates an abscess or collection of pus in the liver. This is a severe case of amoebiasis. It comes with bloody diarrhea, stomach pain, and also a fever. As for diagnosis, first we have biopsy of the colon. The doctor removes a piece of the colon and checks under the microscope to check if you have the protozoan. Second, antigen testing. It detects the presence of a specific viral antigen that indicates the current infection. An antigen is a foreign substance that causes an immune response in your body. And now third, stool sampling. The mature version of the protozoan or trophozoite can also be found in the feces. So, doctors take a sample of your feces and check it under the microscope. And lastly, we have serology, where laboratories check for the presence of antibodies or other substances in the blood sample. And now, for treatment. For both adults and children, metronidazole 500 milligrams orally every 6 to 8 hours for 7 to 14 days. And tinidazole for adults, dosing is 2 grams orally each day for 3 days. And with that, we conclude that you also do not have amoebiasis. Very good. So far, you don't have malaria and amoebiasis. So now let's see if you have toxoplasmosis. Toxoplasmosis is caused by the protozoan species Toxoplasma gondii. There are two types of toxoplasmosis. One is acquired and one is passed down. I'll be telling you the difference later on. First of all, the symptoms will show 5 to 23 days after the infection. Mice, cats, and livestock are hosts for this protozoan. Sources of this protozoa are cat feces, undercooked meat, but you can also get it from an organ transfer or blood transfusion from an infected individual. Another, which is the passed down version, is vertical transmission, which is toxoplasmosis that is passed down to the child of an infected pregnant mother. Now, symptoms. First, we have is the most common symptom, which is the swelling of the lymph nodes. We have headaches, myalgias or muscle pains, pharyngitis, and lastly, hepatosplenomegaly, which is the enlargement of the liver and spleen. As for diagnosis, we have serology, which checks for blood samples, CSF or cerebrospinal fluid right gem cell stain. This means staining the blood to find blood's parasites. We also have PCR, which is the polymerase chain reaction, which checks for genetic evidence of Toxoplasma gondii. For treatments, often none are required. Your immune system will usually take out the virus by itself. However, there are special considerations such as pregnancy, HIV patients, and eye disease. For pregnancy, pregnant women can take spirimacin or pyrimethamine and sulfadiazine. For HIV patients, they take pyrimethamine and sulfadiazine. For eye disease, they take corticosteroids. Well, now that we are sure that you don't have any of these diseases caused by protozoa, I'll be sharing to you some tips on how to prevent them or how to not get them. First being avoid cat feces if you're pregnant. Second, avoid drinking pond, lake, river water. Eat only cooked food. And thoroughly wash vegetables. Boil and filter water. That's it. Now, let's see the table of contents. So, you don't have any malaria, you don't have amoebiasis, you don't have toxoplasmosis, but you do have prevention. And thank you so much for listening. Once again, I am Jason, MD, professional and irrational. Be saying to you, good night.